The Life-Sustaining Treatment Decision Initiative is really a VA nationwide effort to support and be proactive in patient-centered care. It's about having goals of care conversations with veterans with serious illness, to understand what their goals are, what matters to them, and then to get that documented in the medical record.
When people have a serious illness, it becomes even more critical and more important for us to attend to really what are their values, what are their preferences. So really shifting from it being the doctor driving the car with the patient in the back seat and it's up to the doctor to get the patient there, this flips things around and this really brings the patient front and center.
To find out what is important to our patients, we have to do this radical thing. We ask them.
It's really important for us to sit down with them and ask them the type of care they want to receive and find out what their goals are, what their values are, and their preferences so that we can provide them with care that matches their wishes.
And they're just seriously ill veterans that have things like heart failure or COPD or metastatic cancers, and we know they're going to have issues and they're going to have problems. And we're not getting that information soon enough. And oftentimes we wait until there's a crisis, and by then it's often too late.
We all get caught up in the hustle bustle of, starting chemotherapy or getting labs or looking at their most recent scans, and these conversations about what they really want from life and from healthcare get lost in all that when these are probably the discussions on which all those other things should be based. I think giving them that time and space early on in the disease process is better than doing it later when there's chaos and there's confusion and there's people they don't know in the room that they don't trust.
The National Center for Ethics in Healthcare has developed a packet of products that will help you in implementing this new life-sustaining treatment plan process.
We at Madison were one of 4 VA healthcare systems who tested the processes and tools associated with this initiative, along with Lovell in North Chicago, Salt Lake City, and Black Hills, South Dakota.
We at the Lovell Federal Healthcare Center were very proud to be a part of the testing of the Life-Sustaining Treatment Decision Initiative. This is a very important initiative, and we're fortunate the VA, once again, is out front in this critical patient-centered initiative. And it's all about doing what's best for the patient.
We volunteered for the pilot project to be able to put systems in place to honor those patients' wishes in life-sustaining treatments.
So it was something that we thought that we could give back to the veterans by participating in this pilot and working out some of the little bugs and really helping to make it smooth implementation for the rest of the VAs. So participating in the pilot was really just a matter of fulfilling our I-Care values.
The Life-Sustaining Treatment Decisions Initiative is really a package. You get the new policy, progress note template to document your goals of care conversations with your patients, the Life-Sustaining Treatment Order Set, which defaults right to the top of the Orders tab and doesn't expire. There's pocket cards, worksheets, brochures for patients and their families, podcasts and videos, educational modules for staff, and a Train the Trainer program to help providers learn to have goals of care conversations with their patients.
The Life-Sustaining Treatment Progress Note allows you to document the goals of care conversation with your patient and their decisions about life-sustaining treatments. So not only do you document your code status, but you also document and have a conversation about other life-sustaining treatments, like mechanical ventilation, feeding tubes, or dialysis, whether or not they would want these treatments done.
The Life-Sustaining Treatment Order Set actually follows the patient from one location of care to another and can be written in the outpatient setting.
The other nice thing about the template that I really like is that it launches orders. So if I have this conversation with a patient in clinic, the template that I fill out and the order set that are generated from it will then be durable. And so if the patient gets admitted 6 months later to the hospital, people know, oh, Dr. Rose had the conversation with the patient and it's all documented and the order set's there.
I imagine that the first thing that some people are thinking is that this may just be a duplication of our work in advanced directives. Advanced directives can be completed by any person, regardless of their current healthcare status.
Advanced Directive serves as a guide for family and healthcare providers. They're documents that people can complete at any time that express their wishes related to who they trust to make their medical decisions, what kind of care they might want in future situations if they lost their decision-making capacity.
Life-sustaining treatment orders, on the other hand, are very specific orders and decisions made by patients after they've been diagnosed with a potentially serious medical condition. These are true orders that are entered into the patient's record by their healthcare provider that delineate what treatments they want should they experience a life-threatening clinical event.
One of the real values, in my opinion, of the LST note template as well as the orders is that when you get called on a patient you're covering, you have to go to the bedside urgently and he or she isn't doing well, you can look up very quickly, and it's very clear in the orders what he or she would or would not want in that situation.
The great thing about the template, too, is that it shows up in postings so people know where to look for it, and I think that's really a nice component of it. The other really nice part of it is that those orders also go to the top of the order set, so when nurses, other staff, or when I'm looking for orders when I'm in inpatient medicine, I can find exactly what the patient wanted and exactly what conversation was had with the patient and document it.
The life-sustaining treatment progress note and orders are durable. They're active both inpatient and outpatient. So we had to educate our providers that the notes were durable and to look for them when they first admitted a patient. They didn't need to duplicate them unless there was a change in their life-sustaining treatment decisions.
And one of the new things now is that nurse practitioners, physician's assistants, residents, and attendings can all write life-sustaining treatment notes and orders.
So in terms of goals of care conversations, I think it's everyone's responsibility in terms of all providers. Sometimes it makes sense for specialists to address this, whether the patient's cardiologist or, neurologist or pulmonologist. At other times, it definitely makes sense for the patient's primary care provider, who ideally has continuity with the patient, to talk with them about their goals of care. And even further in terms of what sort of life-sustaining treatments they would and would not want.
Certainly not every primary care patient needs to be having a discussion about life-sustaining treatments decisions, but we do take care of higher risk patients who are at risk for having some type of life-threatening clinical event in the next 1 to 2 years, and those are the patients that we're trying to target.
The challenge is going to be, in part, this is new territory in the outpatient setting. Typically, in particular, do not resuscitate orders and conversations have really not been a part of the typical primary care outpatient environment. So it's new territory for the primary care staff.
They may not feel comfortable or feel like they have the skills to have goals of care conversations. This isn't something that we typically get as part of our medical education. But what's really exciting is that VA actually has formal training in goals of care conversation. This is training created by national experts, and it's available for all of our providers to learn how to have these vital conversations with people.
This program is giving us a real roadmap to teach people how to have these conversations. And this is the very essence of patient-centered care.
One of the key elements to make this initiative a success is to have leadership buy-in. You need to have leadership with enough clout to make things happen.
So at VA Black Hills Healthcare System, we decided to form an advisory board, which is a work group, multidisciplinary. This was a way for us to really look at how to roll the initiative out at VA Black Hills.
One of the key things in our successful implementation of the Life Sustaining Treatment Project here in Salt Lake City was that our advisory board was incredibly strong. And that advisory board was hand-selected by our chief of staff. And she really found just this diverse group of people that could look at the implications from their own perspective and help us sort of anticipate what might be problems and what we would need to do to educate staff.
I also would advise that the membership is composed of people who will be champion liaisons on the units, because they will serve not only as resources, but bringing back information to the board that could be critical.
Facilities that are getting involved in this initiative need to educate their staff early and often.
We have learned that the education piece requires much more than just the TMS training, and we've developed a plan to outreach to staff in a variety of ways.
It's important to hit people one-on-one. If they're individuals who find this a little complicated to learn and change, it's important to have tip sheets to hand out. It's important for people to learn online in TMS modules, and it's important to meet people in staff meetings. It really requires a multi-pronged approach to educate everyone.
We're affiliated with a university hospital, so we have lots of residents coming through every month, and it was really important for our facility to educate nursing staff, social work staff, make sure that they have a solid understanding of this process in order to be a support to these residents and providers that are moving through.
It was really important that we had our night float residents aware of the changes that were coming, that we sought them out specifically and gave them extra instruction on what to expect. And then also that for the initial time period of the rollout, we needed to have someone available 24/7 because obviously night float is going to be running into questions in the middle of the night.
Patients are ready to have these conversations, and it is very important for us to support providers to participate in this training and make time for these discussions that are very important to our patients.
Right now, of course, access to care is a concern. When you look at the life-sustaining treatment decision initiative, it really takes, as a leadership team, a concerted, intentional effort to put systems in place to support our primary care teams.
People are worried about how much time this is going to take and how much effort it's going to be and if it's going to pay off. And I think to be able to go up front and spend a little extra time eliciting from patients what their goals are and ensuring that our medical plans, our future medical plans, are going to be consistent with that can save a tremendous amount of everyone's time.
But these conversations take time, they take sensitivity, and I know that my support is if they need extra time for those appointments, if we need to look at doing double appointments, I think it's important that our staff understand that this is supported from leadership in order for us to focus on our veterans' needs.
It's been exciting to see that patients are now coming into the hospital with these orders and having had these conversations, which really helps us and patient in terms of directing the patient's care and not trying to force these conversations when they're sick and maybe, unable to have them or can't have them.
We need to help and really partner with our patients, and I think that's one of the things that I'm most excited about with the life-sustaining treatment initiative.
What this project is really about is clinicians asking patients what they would want done and document it in the record. This is really the right thing to do for our patients.
I think that the VAs have a moral obligation to really lead the way in patient-centered care. We've made a promise to the veterans. It goes all the way back to Abraham Lincoln. And this is a gap in our healthcare system. And we really can lead the way for a new approach to having a dialogue with patients and veterans about their goals of care. And then sticking to it.